There are many doctors, medical practices, and hospitals, etc., that offer free MRI reviews. And you can easily search these on the internet. Yeah, and for all the details on my injury and what happened to me, go see my YouTube channel. It's My Medical Nightmare. But just briefly, I had a very serious head trauma-based injury in 2018. I broke the underside of my skull, and I went around to various hospitals and doctors and had CT, X-ray, and MRI scans done of this area. 2019, 2020, 2021, up to the present day. It's September 2nd, 2022. The radiologist and many doctors who looked at these scans, they came back in these official reports and diagnoses and told me with their signature attached that I had no injuries present. And I knew otherwise as a patient. Almost died from this injury in 2019. Around 6 inches diameter infection set in to the area beneath where I broke my skull. You can see these in the MRI pictures. This appears in my head. So I thought I'd send my imagery to yet another doctor on the internet who does free MRI reviews. His state of Florida medical license reads his name as Ara Deukmedjian MD. Now I found this page. It was on the Duke Spine Institute. He's got 2 locations in Florida. 7955 Spyglass Hill Road, Melbourne, Florida, 32940. Also Titusville, 494 North Washington Avenue, Titusville, Florida, 32796. In August 2022, I'll show some of my correspondence with their office person, Darcy Huggins. And at first, I was told that the date of the images were a concern, and that the doctor did not do the free MRI review for MRI pictures that were more than a year and a half old. But finally they agreed to look at my pictures. And actually, yeah, I think this is a bad practice. Doctors out there, you want to look at the MRI and CT pictures, the X-rays of patients regardless of the age. Because if you have a patient who has a serious injury, you want to see the scans of that injury close to the outset of the actual occurrence of the injury. And that, as a doctor, will help you better understand the nature of the injury of your patient. Okay? So these doctors out there that only look at images that are, like a year old or something, this doesn't make any sense to me. I thought that the doctor was going to call me on the telephone, but he did not. And this doctor, he does telemedicine consultations using the video conferencing software Zoom. And so I was told that my free MRI consultation, this would take place as a Zoom video meeting, scheduled for September 2nd, 2022, 2 p.m. Eastern. So I was in the waiting room shortly before 2 p.m. Eastern, and I'm in Alabama, so that was just before 1 p.m. Central Time. After about 30 minutes, the meeting had not yet commenced, and prospective patients out there for Duke Spine and Dr. Deukmedjian, you might want to bear this in mind. Our consultation did not get underway until about after 1 hour had passed from the scheduled appointment. And I was sent an email and told they were behind schedule. I tried to record the actual screen of our interaction through the Zoom software. Following the meeting, the video file, it was not saved. And yeah, when I clicked the button, I was told that Dr. Deukmedjian would have to approve the recording, but he did not. So I had to rely on one of my many backup recordings. And yeah, when I go around these doctors now, I have many recording devices on me, audio and video. And you'll be able to hear our conversation following my introduction here. And yeah, I find it curious, how he questions me about the state of my injury, because yeah, if you're a doctor who can look at these pictures and you simply look at the images, you can easily determine the nature of my injury. Is the person who runs the Zoom meeting, they control the interaction. And so you'll hear in this call where, yeah, I have a lot of difficulty. I cannot share or point out easily areas of the images because I was not allowed to interact and share my screen. The doctor wouldn't allow it. Another piece of advice, print out the images yourself so you can show them to the webcam. All right, and that's something else that I did in this call. I had printouts in front of me, anticipating the fact that I would not be able to interact or share the images that I had right there on the computer ready to show the doctor. And yeah, at the end of this call, the doctor abruptly ended the call when I started putting the printed out images from these scans with the injury circled up to the webcam. He ended the call, so that should tell you a lot right there. He went through several of these pictures, and I tried to have him look at a specific image where I believe the injury manifests itself, and it's around first, second vertebrae. All right, so yeah, one thing that you'll hear in this call is when we are both looking at an image with an injury, this Dr. Deukmedjian, he claims that he cannot see the broken pebble-sized piece of bone that broke off the underside of my skull. And it is clearly visible in these images. And then he tries to tell me that you can't see this in an MRI scan. And this is absolutely not true as well. I mentioned the fact that infection had set in, and then, all of a sudden this doctor, he doesn't want to talk about this injury anymore. Alright, so yeah, after I mentioned that I might have been misdiagnosed, this doctor told me, and you can hear it, that he doesn't treat that kind of stuff. And I believe this is absolutely not the case. There is evidence of an injury, and it's in my head and my neck, and it's in the area where this doctor does have expertise and applies his medical skill via his license with the state of Florida. And then, another thing that he kept saying was, it doesn't matter, there's nothing he can do to help me. And this is absolutely not the case. I believe that it is a doctor's duty, all right, and there's something called the Hippocratic Oath. The first tenet of the Hippocratic Oath is do no harm. And when you have a doctor who can see injuries, who has skill to diagnose injuries, and he does not share this with his patients in consultations, he is in violation of his oath and his duty as a medical doctor.